Welcome back to the AI Nurse, your go-to channel for exploring how artificial intelligence is revolutionizing healthcare and making life easier for nurses everywhere. I'm your host, the AI Nurse, and today we're diving deep into a topic that's close to the heart of every nurse: burnout. Specifically, we're talking about how AI tools can reduce nurse burnout by automating repetitive tasks. If you're a nurse, you know the drill. Long shifts, endless paperwork, constant multitasking, and that nagging feeling of never quite catching up. Burnout isn't just a buzzword, it's a real crisis affecting millions in the profession. According to recent studies, over 60% of nurses report symptoms of burnout, leading to higher turnover rates, decreased patient care quality, and even personal health issues like anxiety and depression. But here's the good news. AI is stepping in as a game changer. By automating those soul-crushing repetitive tasks, AI can free up your time, reduce stress, and let you focus on what you love most: caring for patients. In this video, we'll break it down step by step: what nurse burnout looks like, how AI works its magic, specific tools and examples, real-world benefits, potential hurdles, and a peek into the future. Stick around till the end for some actionable tips on getting started with AI in your workplace. Let's start with the basics. What exactly is nurse burnout? It's that overwhelming exhaustion, physical, emotional, and mental, that comes from prolonged stress. Common causes include heavy workloads, staffing shortages, administrative burdens, and the emotional toll of patient care. Symptoms? Irritability, fatigue, cynicism, and reduced performance. The impact is huge. Hospitals lose experienced staff, patient satisfaction drops, and healthcare costs skyrocket. Repetitive tasks are a big culprit. Think about it. Nurses spend up to 35% of their time on documentation alone, according to the American Nurses Association. That's hours every shift typing notes, updating charts, and logging vital signs. Add in scheduling shifts, managing inventory, and following up on lab results, and it's no wonder burnout is rampant. Enter AI tools. Artificial intelligence isn't some sci-fi robot taking over. It's smart software that learns from data and handles routine jobs with speed and accuracy. In nursing, AI can automate these tasks, acting like a tireless assistant that never needs a coffee break. First up, automating documentation and charting. Traditional charting is tedious, manually entering patient data into electronic health records, EHRs. AI-powered tools like voice-to-text transcription can change that. Imagine speaking your notes into a device and AI instantly transcribes them accurately, even understanding medical jargon. Tools like Nuance's Dragon Medical One do this seamlessly, reducing charting time by up to 50%. Nurses at facilities using this report feeling less rushed and more present with patients. But it goes beyond transcription. AI can auto-populate charts with data from wearables or monitors. For example, if a patient's heart rate monitor detects an anomaly, AI can flag it in the EHR and suggest notes based on protocols. This not only saves time but minimizes errors. Human fatigue leads to mistakes, but AI doesn't get tired. Next, patient monitoring. Nurses often juggle multiple patients, constantly checking vitals. AI systems like those from Philips or GE Healthcare use predictive analytics to monitor in real time. These tools analyze data from sensors and alert nurses only when intervention is needed. Instead of hourly rounds for stable patients, AI handles the watch, freeing nurses for critical cases. Studies show this reduces false alarms by 30 to 40%, cutting down on alarm fatigue, a major burnout trigger. Scheduling and administrative tasks are another repetitive nightmare. Shift planning, vacation requests, and compliance tracking eat up hours. AI platforms like ShiftWizard or NurseGrid use algorithms to optimize schedules based on staff availability, patient needs, and fairness. They predict staffing shortages using historical data and even automate reminders for certifications. One hospital using AI scheduling reported a 20% drop in overtime, meaning less exhaustion for nurses. Medication management is ripe for automation too. Dispensing meds, checking interactions, and tracking inventory, it's all repetitive and error-prone under stress. AI tools like Pyxis MedStation or Omnicell integrate with EHRs to automate dispensing, verify dosages via barcode scanning, and flag potential interactions instantly. Pharmacists and nurses save time on manual counts and error rates plummet. In burnout terms, this means fewer near-miss stresses that weigh on your mind. Data entry and reporting? AI excels here. Tools like IBM Watson Health can pull data from various sources, generate reports automatically, and even highlight trends for quality improvement meetings. No more sifting through spreadsheets. AI does the heavy lifting, so nurses can contribute insights without the grunt work. Communication is key in nursing, but it's often fragmented. Phone calls, pages, emails. AI chatbots and virtual assistants streamline this. For instance, apps like Tiger Connect use AI to route messages intelligently, summarize patient updates, and even translate languages for diverse teams. This reduces miscommunication delays, a common frustration leading to burnout. Now let's talk benefits. By automating these tasks, AI gives nurses back their time for direct patient care, which is the fulfilling part of the job. Research from the Journal of Nursing Administration shows that nurses using AI tools report higher job satisfaction and lower burnout scores. Errors decrease, patient outcomes improve, and turnover drops, saving hospitals millions. Take a real-world example. At Cleveland Clinic, implementing AI for predictive monitoring reduced nurse response times and burnout rates by 15%. That is a big win for everyone. Nurses felt empowered, not overwhelmed. Another case, a rural hospital in Texas adopted AI documentation tools, and within months, staff reported better work-life balance, with fewer nurses leaving the profession. Of course, there are challenges. Privacy concerns with AI handling sensitive data. HIPAA compliance is crucial, so choose tools with robust security. Integration with existing systems can be tricky. It requires training and IT support. Cost is a factor for smaller facilities, though many AI tools offer scalable pricing. And the human touch, AI can't replace empathy, so it's about augmentation, not replacement. To overcome these, start small. Pilot one tool like a transcription app and train your team. Involve nurses in selection to ensure buy-in. As for the future, AI is evolving fast. We're seeing generative AI like ChatGPT adapted for nursing, creating care plans or educating patients. Wearable AI for nurses themselves could monitor their stress levels and suggest breaks. In conclusion, AI isn't just a tool, it's a lifeline against burnout. By automating repetitive tasks, it restores balance, boosts efficiency, and reignites passion for nursing. If you're feeling the burn, explore these tools. Talk to your admin, join online communities like ours, or check resources in the description. Thanks for watching The AI Nurse. If this resonated, hit like, subscribe, and comment below. What's your biggest repetitive task? Let's discuss how AI can help. See you next time.